I'm delighted to say that Dr. Lucy Jessop, the Director of the HSE National Immunisation Office, is with me in studio. Lucy, you're very welcome to the show. It's good to talk to you.
Thank you very much for having me.
Lots of people getting in touch with questions. This because the vaccine portal registration opening up now for 12 to 15 year olds. I suppose before we get into the questions, we should acknowledge just what an incredible success the vaccine rollout has been. Admittedly, I was one of those at the start who was maybe sceptical about our ability to do this so quickly and so efficiently. Happy to say I was wildly wrong in this instance. It's been incredible, hasn't it?
It has been amazing, yes. I suppose at the start of a programme you're never entirely sure how things are going to go, but it's been amazing. The Irish people have been really got on board with the programme and come to get their vaccines as soon as they've been eligible for it. So we've done extremely well. We're one of the highest in Europe, which is really a testament to everybody involved in the programme and all the people that have come forward to be vaccinated to protect us all.
Were you and your colleagues pleasantly surprised at the lack of vaccine hesitancy in Ireland? Because I remember maybe towards the end of last year when we knew the vaccines were coming, there was a lot of conversation about, that there would be understandable vaccine hesitancy because it was a new vaccine and it had come through so quickly, and how were we to engage with people and win people over? And it turned out, yes, I suppose maybe people were won over by those conversations, but actually the level of vaccine hesitancy was probably not as high as a lot of us suspected it might be.
Yeah, you're right. I mean, there was a lot of work done, I suppose, a lot of explanations given that in the main vaccines do take a number of years to develop, but these vaccines had the same amount of time put into them, but in parallel rather than in series. So that's why all the same steps were taken in terms of regulation. No corners were cut. And I think explaining that to people, and obviously there were quite big studies anyway. It wasn't as though it was, hardly anyone had had the vaccine by the time it came to us. There were big studies and we had quite a lot of evidence. So people have been very confident in it, which has been great.
And in the same way, you can probably understand why we're getting so many questions today that, people would have been maybe first in the queue, top of the line to get the vaccine themselves. But when it comes to vaccinating their kids, I suppose it's a protective thing. It's an evolutionary thing. It's a survival thing. We're understandably maybe a little more cautious.
Oh, absolutely. Yes. A decision you make for yourself is quite different for a decision you make for your child. And I completely understand, why parents would want to ask questions and would want to look at reputable information. And that's why we have quite a lot of information now on the hse.ie website. And I would really just encourage parents, obviously we'll have some answers here today, but to have a look at that website, look at them with their families, read them with their children, and just consider which is the best option for them and their family.
Well, 53106 is the number. If you want to text in your questions, there's still a chance to get them in, but we'll get into some of them now. Jennifer Leahy, for example, got in touch on Twitter and she says, there's 3 adults in my home and all are fully vaccinated, but I'm unsure about vaccinating my 12-year-old because she has no underlying health conditions. What is the reason for vaccinating?
Yeah, so the National Immunisation Advisory Committee gave a very comprehensive paper about why they made their decision in terms of offering the vaccine to 12 to 15-year-olds. So they're very clear that they strongly recommend it for children who have risk conditions or who live with people that have conditions that make them at high risk of COVID-19 disease. But for other parents, it's really an individual decision for them and their child because, as your caller sort of is inferring, the risks of COVID to people of that age, young people, are quite low. The risks of very severe COVID or hospitalisation is low in that age group. But we do also know, obviously, if you get COVID, you do have to stay off from school. You will miss school. Your household will have to isolate. So there are other effects on children, and rarely children do become unwell from COVID. So it's really an individual decision for that person to have a look at the evidence and see if that's right for them.
Okay, and their family. Because in some other jurisdictions that they're only vaccinating people in that cohort you maybe described there, people with underlying conditions. We've gone for the broad brushstroke here, but is it the preference then of the HSE that, to kind of put it in kind of loose language, that the people at the top of the queue are those people with underlying conditions or living with someone with an underlying condition, that it's most important that those children get vaccinated first?
I think we have a lot of availability of appointments and vaccines, so I wouldn't say they need to be vaccinated first, but those are the ones that I would most strongly recommend to come forward. And then everyone else obviously is welcome to come forward and bring their child if they feel that's right for them.
This question touches on something you've mentioned already about the rigorous nature of the safety protocols that exist around the development of vaccines. I've got a question here. Why would I give an experimental vaccine to any of my children when they're practically at no risk from COVID? As Luke O'Neill says, it's an incredibly mild illness in children.
Yeah, I suppose we have touched on that. It's not no longer an experimental vaccine. It has been tested for quite a long time now. So I would maybe encourage someone to look at those studies and see. But they are right. It is generally a rare, a low risk in children. So it really is up to that person to decide whether they want to offer it to their children or not.
Denise Connolly is wondering if the advertised side effects for the vaccine in adults are the same when it comes to teenagers.
Yeah, in the main they're the same. So most of the side effects are mild to moderate and short-lived. So the normal things you might think of with vaccines. So a fever, sore arms, sort of muscle aches, headaches, feeling a little bit unwell for a couple of days. There are rarer side effects like an allergic reaction. And then there are these rare side effects of the mRNA vaccine. So the vaccines we'd be offering to children, which are the myocarditis and pericarditis. So those are inflammatory conditions of the heart. We do know those are a bit more common in younger people. So around 1 in 100,000 for girls aged 12 to 17 and about 1 in 16,000 for boys aged 12 to 17 in studies that are coming across from America. So there is that risk of those conditions as well for these vaccines.
So 1 in 100,000 for girls and 1 in
16,000 for boys.
For boys.
It's a little bit more common in the boys. These are usually self-limiting and people would recover from the conditions. But
because I was going to ask, because based on those figures, in all likelihood, someone in Ireland will fall foul of that 1 in 100,000 rate or 1 in 16,000 rate. But they generally resolve themselves.
Recover. They might need some treatment in hospital, but then people would recover, and we are making the clinicians aware of that, so they know what to look out for.
What exactly is myocarditis and pericarditis?
Myocarditis is inflammation of the heart muscle, and pericarditis is inflammation of the sort of surrounding of the heart, the pericard.
Okay, but they're not something that people necessarily need to be overly worried about.
No, so when you get your vaccine, you do get a sheet of information so that tells you the symptoms and signs to look out for. So it's things like chest pain, palpitations, and if you have any of those symptoms, you should go and see your doctor, and they will refer you onwards if necessary.
Another listener's after getting in touch on Twitter. I was going to say the name until I realised it's Tato is alive, whatever that means. Will vaccinating teenagers reduce their immune system's ability to fight other infections or viruses naturally?
So some people do worry about those kind of things. I mean, our immune systems are bombarded with all sorts of things every day. So we're able to take on lots and lots of different infections, viruses and bacteria every day, and we fight them all the time. And with babies, we give them lots of vaccines all at the same time. So there's no evidence that giving someone a vaccine would reduce their ability to fight any diseases. And in fact, it obviously stimulates your immune system and keeps your immune system ready so that if it does encounter COVID-19, you are able to fight it without becoming unwell, which is obviously a good thing.
Quite a few people texting with the same question, which is around the HPV vaccine. My daughter had her second HPV vaccine last May. Is it safe to give the COVID vaccine? Someone else, my 14-year-old has received their HPV double vaccine in the last 8 months. Is it advisable to get COVID on top of that?
Yep, so obviously this age group are those that have just had possibly HPV vaccine or are about to have it in this coming academic year. The National Immunisation Advisory Committee have said it's fine to get these vaccines even on the same day. You can have 2 vaccines, a COVID vaccine and a different vaccine, so there's nothing to worry about being vaccinated, and they've even advised us possibly if we are to do boosters we may give the flu with the COVID vaccine at the same time, so it's perfectly fine to have them at the same time or any other interval.
All right, okay, so don't be worried about whether the HPV was last May or in the last 8 months like that other listener, or whether it's even on the same day.
Yeah, or coming up in October. There'll be those in first year of second level will be being offered it from October of this coming year.
Is it possible, wonder somebody else, to pick the vaccine, or is the Pfizer vaccine the only option available?
So it's the mRNA vaccines that are licensed in this age group. So it's the Pfizer and the Moderna vaccine. So they are both mRNA vaccines. You can't choose to have another vaccine in this age group because they're not licensed. But it's one or other of those vaccines. Most likely the Pfizer vaccine.
And when you say not licensed, I mean, is that from European authorities or from our own authority?
Well, from both. But basically, the European Medicines Agency haven't licensed the vaccines for under 18s except for these 2 vaccines.
And have they made a decision not to license them, or is it that it's still under review?
So what happens with the European Medicines Agency when they're licensing something, they need to have information from the companies who will then ask them, will you consider this for license? So they haven't received that information from the companies, therefore they haven't.
So it's not that they've received it and turned it down, they just, an application essentially hasn't been made by Janssen or... I'm after losing track of my vaccines. AstraZeneca.
Yes, exactly. Yes, they've only asked to license them from 18 and above. But these 2 companies have submitted the dossier for down to 12 years and it's been licensed.